I'm Patty Nece. I'm chair of the Obesity Action Coalition. OAC is a nonprofit organization dedicated to representing the interests of people affected by obesity. I'd like to start out in a different way than you're probably used to in most seminars you attend. I'd like to just sort of clear your mind if you can. Take a deep breath and take a look at me. And I want you to be honest with yourself about what automatic thoughts pop into your head when you look at me. I know this is a little harder because you're virtual or we're virtual and you're not seeing my entire body, but there are some things I'm sure you'll notice just from the top frame here. So just take a second and try and identify those thoughts you're having. Okay, so I obviously carry excess weight. And I'm wondering, did you think, wow, that's a great color on her? She should wear that more often? Maybe you thought, she looks studious with those glasses on. But maybe you also thought something like, she must not care about her health. Or she's so fat, she must eat junk food all day or never exercise. Or worse yet, she's lazy or stupid. I can't say that I necessarily blame you if any of those thoughts occurred to you, because weight bias, which is negative attitudes towards people of size, is rampant in our culture. And medical professionals are just as susceptible to all those influences as everyone else. But here's why it's important that you work to overcome those biases. People like me, who have spent a lifetime with obesity, have faced bias and stigma many, many times in medical appointments and in medical settings. And patients coming to you are likely to have also experienced the same thing. So there's a lot of anxiety. They're not happy to be going to see a medical professional. And it calls for a different sort of care. It's almost a trauma-informed view, because that's what weight bias is. It's a trauma. And I've been judged by my size my entire life. Despite all the successes I've had professionally, despite all the successes I've had in leading organizations, in relationships, in family relationships, I've always been judged by my size. I don't remember a time when I didn't have obesity, when I wasn't one of the largest kids or one of the largest adults in the room. I've had obesity since childhood, and it's been, persisted throughout my life. So the teasing, bullying, and ridicule started very early for me. And, it came from friends, it came from peers, it came from family members. But perhaps worse than that is it came from members of the medical community who were in positions of authority. The best example I have of that is a school nurse, I think I was in third grade, who wheeled the scale into the classroom, proceeded to weigh every student in front of each other. Well, I didn't want to get on that scale, but I always followed the rules. So I got on the scale. Back then, it was those old height and weight charts. We didn't have BMI. And she took my height, she measured my weight, and she looked at the chart and she said, in front of the rest of the class, "You're fat. You need to lose weight." What do you want to do when you're a kid more than anything else? You want to fit in. And here I was being singled out by a person of authority, not for my perfect attendance, not for my straight A's that I got in classes, nothing positive, but just because of my size, I'm being belittled by this person. Those sorts of experiences stick with you And you think it's going to get better when you get older, but it doesn't. I cannot tell you the number of times passers-by in cars just feel free to yell out their windows at me, shamu or moo or whatever. We tolerate that in our society, and it's got to stop. It all makes a difference. All that bias comes from a number of places, all sorts of media, individual interactions, family interactions, but also from the medical community. And I'd like to share a few of those experiences with you so you understand what I'm talking about. You know, one of the things that is important is just the plain physical environment in medical settings. I went to get a mammogram when I was 40, 42, somewhere in there, to get my first mammogram. And I went to it was a radiological facility that I had it at. And they gave me a gown to put on. Well, the gown didn't even come close to covering me. And then they gave me another gown to put over the other side of me. So I had one on the front and one on the front and one on the back. Well, I was sort of compressed in there. And then they had me wait with other patients in a room where there were people sitting there, and I didn't feel covered. I didn't feel comfortable. I was embarrassed. I was ashamed. It was horrible, all for the lack of an appropriately sized gown. And then when I had the mammogram, things like the apron they used to shield you from some of the radiation didn't fit well. It was just a bad experience. I waited 15 years to have my next mammogram. I just couldn't go back to that again. I didn't want to go back to that again. It had been such a humiliating experience. I didn't want to go back to that. Then in interactions, you turn to the medical community to work on helping you manage your weight. I need all my fingers and all my toes to count the number of physicians who said, with a finger wagging, you need to eat less and exercise more. Well, gosh darn, I had never thought of that. That never occurred to me. What a shock. You think that might help? The fact that I had tried every single diet known to man, well, except maybe the cabbage soup diet, because I don't like cabbage, and tried my entire life to lose weight. Your finger wagging is going to make a difference. In fact, all those diets I tried and failed to lose weight, that I at least sustained the weight loss with, drove me to a place where I was ashamed. Every time I failed, my shame grew more, because we're told, like the finger wagging doctor, that our weight is all our fault, that we're totally in control of our weight. And if you just push away from the table and move more, your life will be puppies and unicorns, and your body will be perfect. That's not how it works. It just does not work that way. And if you walk away from nothing else from this course, I hope that's it. An appreciation for the complexity of weight management. So those doctors who were waving their fingers at me weren't helpful. The medical professionals who hand me a diet and say, here, follow this, not helpful. The nutritionist I saw who told me you could only eat 3 meals a day, who refused to reconsider that in my personal case, when I was so hungry in the middle of the night, it was waking me up and interfering with my sleep. She insisted you have to stay with 3 meals a day. It's all you can do. It's not going to work otherwise. Well, white knuckling through something like that is not a solution to treating obesity. Then there's the whole category of cases where physicians just refuse to look past weight to diagnose other issues. that the patients are suffering. The worst I had was an orthopedist. I had intractable hip pain, could not figure out with my primary care physician what was going on. He referred me to an orthopedist. The orthopedist walked in the room. Actually, first his assistant walked in the room to give me this teeny tiny pair of paper shorts to put on. They might have fit on one of my legs, but not both. First humiliating experience in that appointment. Inadequate medical equipment. I started, and then when the orthopedist came in, I started to tell him what my symptoms were. He let me get about 2 sentences out, maybe. He interrupted me and he said, "Let me cut to the chase. You need to lose weight." And I said, "Well, I'm surprised I'm having this pain now because I had just lost 70 pounds. "Well, you need to lose more weight. Have you considered weight loss surgery? I see this all the time." And he went on for what seemed like an hour, but was probably only about 3 minutes because I obviously wasn't worth his time, berating me about my weight and telling me how it's all my weight's fault. That's what's going on here. That's what's causing the pain. By the end of this, I'll loosely call it a discussion. It was not a give and take. It was a lecture from him. I was in tears. And he said, "See, you're even crying because your weight's causing you pain." I wasn't crying because the weight was causing me pain. I was crying because he was such a jerk to me and treated me without any sense of respect or dignity or caring or concern. And I was in pain. That's not a way to foster a good relationship with a patient. So he called my primary care physician after the visit. Oh, and by the way, he never examined me. The only time he touched me was when he shook my hand as I walked out the door. Then he called my primary care physician. He diagnosed me with obesity pain. And I said, "What?" And my primary care physician, to his credit, said, "I did miss a couple classes in med school to play golf, but I haven't heard that diagnosis in the 30 years I've been practicing medicine. It's not a diagnosis. It wasn't helpful. He refused to look past my weight to see what was really going on." Well, when I had the courage to go back to a different orthopedist a couple months later, because the pain was just incredible, I found out that I had a 60-degree curve in my spine. I had progressive severe scoliosis. That's what was causing my pain. And I'm not so naive to think my weight doesn't also increase that pain or play a role, but it didn't cause the scoliosis. And now that I had a diagnosis, I could actually do some physical therapy and some other things to help alleviate the pain I was in. And the only reason I didn't get that diagnosis sooner was because that physician failed to look past my weight. I wish I could tell you mine is an isolated case, but it is not. The stories of that are legion. And at the Obesity Action Coalition, about 95% of the complaints we get are about weight bias in medicine. Experiences like that other people with obesity have encountered. I've told you a lot about the bad, but let me tell you about the good. I had tried all these diets, been to nutritionists, been to an endocrinologist, been to doctors, nothing had worked. I gave up trying. I stopped trying to manage my weight. I just isolated more, which of course, in my case, led me to eat more. And I finally decided I was tired of living that way. And I found an obesity medicine specialist. He's actually one of your panelists today, Dr. Scott Kahan. It was a totally different experience with him. Even though I obviously was there to talk about weight, he's an obesity medicine specialist. He asked me respectfully if we could talk about my weight. And I said, "Well, Yeah, I mean, that's why I'm here. But the big key was he didn't judge me at all for my weight because he understood the complexities of weight management. It was a new experience for me. I had never had an encounter like that with a medical professional who didn't judge me because I was a person of size, because I hadn't been able to lose weight on my own and manage my weight on my own. He created a welcoming environment from a physical perspective. There were adequate chairs in the waiting room, adequately sized blood pressure cuffs, a scale that went up to a high number. I don't know exactly what number it goes up to, honestly, but in a private room where not everybody else in the office is seeing your weight. And actually, you can go in there yourself and weigh yourself if you want. I mean, it was just a totally different approach. And his entire staff had that attitude. The other thing that was different is that he took a 360-degree approach to weight management. I had psychologists who supported me, registered nutrition dietitians who supported me, movement specialists who supported me, and Scott, who provided medical care. It was a complete package. And frankly, I needed all of that because, especially the psychological piece, that was important for me in particular, because all the weight bias and stigma I had encountered throughout my life, I had what's called internalized weight bias. I had become my own worst bully. And until I started fixing that, I really couldn't fix anything else. So that was an important piece of the puzzle for me. With his and his team's help, I took off about 120 pounds and kept about 100 of it off for about 5 years. I have since then had some weight recurrence, which is not unusual, and it's a normal part of obesity. And I'm now we've gone back to the toolbox. I'm working with Scott again, looking at what other tools we can use to address the weight recurrence. But he's not judging me for having regained weight. He's not blaming me. That's the furthest thing from his thoughts. And it's such a relief, and it makes me want to actually interact with him. And every decision we've made along the way has been a shared decision. We talk about options that were available for me, treatment options, medication options, surgical options, diet, different sorts of nutritional options, everything. You know, I came away from my first appointment with him with deciding to take 2 steps, adding a protein-based snack between breakfast and lunch and dinner, and taking vitamin D. They were small steps, but I was able to then build on those. And they were all things I thought I could do and I could actually accomplish, which was very important to my progress. It was a great starting point. But we made all those decisions together, and that was empowering to me. That was empowering, and a way to empower your patients. He also gave me hope that there was help and that we could work together on this. My call to action for you, based on all these experiences, is to start by addressing your own biases. Think about what are your automatic thoughts when you see somebody with obesity? Are you judging them rather than trying to extend understanding and compassion? Learn as much as you can about obesity science. And importantly, the treatments that are available. More and more treatments are emerging every day for obesity. It's an exciting time to be working in this field. Create a welcoming physical environment, adequate chairs, adequate medical equipment, adequate exam tables, and for heaven's sake, adequate gowns. How hard is it to have very large gowns to make patients just feel comfortable and feel like you care about them. That's what it's all about, right? Leave your judgment at the door. Don't make assumptions about your patients. Don't assume that they don't care about their weight or that they're not exercising or they're not eating in a healthy way. Ask, find out. You might be surprised by the answers you get. Partner with your patients and give them some hope. Use all those shared decision-making tools that you have in your arsenal. We do that in so many other areas of medicine, but we rarely find that in obesity. That needs to change, and it will help your patients immensely. And last but not least, call out weight bias wherever you see it. It is ubiquitous in our society, and we need medical professionals to start addressing it and calling it out and saying that it's harmful, it's damaging, it's flat out wrong, that people of all sizes are worthy of dignity and respect. I'd like to leave you with a few tools too, a few additional resources. The first is the Obesity Action Coalition's website. It has great information about weight bias and is a great place for your patients to find support. Please refer them there. There's a wealth of information on the website. The second is from the Stop Obesity Alliance, which is based at George Washington University. They have published a Why Weight guide that talks about how do you have this conversation with patients? How do you talk about weight? How do you create physical spaces that are appropriate for people with obesity? Check that one out. And the last one is the Weight Can't Wait guide. The Stop Obesity Alliance produced this one too. It's designed for people who are in primary care to try and start addressing weight with their patients. There is a wealth of information in the guide and an abundance of resources linked in it. And I think all these resources will help you treat your patients with obesity in a non-biased way, but also in an effective way. Thank you for your time. I really appreciate you listening.